there, this is Dr. Aditi, and today we're talking about the anatomy of the skull. We're going to go over a myriad of features of the skull, from structures, foraminas, passages, prominences, all that. Now, the best way to learn this information is actually a hands-on approach, right? So if you have a model of a skull, because of course we all have models of skulls just laying around our house, use that. Well, to be fair, when I first started learning, I did purchase a whole box of anatomy bones because I'm a hands-on learner, so that really helped me. But you don't obviously have to have one. You can also just print out a picture of the skull in different purviews and follow along that way, and then you're tracing and writing as we go. That's another kinesthetic approach. The other thing you can do if you have don't have access to either of those at this moment, use your own body, right? You've got a skull. Imagine that. Handy enough. It's right on you. So you can just use your own body to do that too. Now, the other thing I'm going to give you in this episode is mnemonics to remember the skull, because there are 22 bones that you have to remember. So mnemonics do sort of help things out there. And then lastly, of course, we will do a mind map to sort of summarize everything and bring it all together. So let's get cracking. Right, so the first thing you need to know is that the skull has 22 bones. Now, 8 of those are in your brain case, which is the neurocranium, and then 14 of those are actually your facial bones, right? Now, all these bones tend to be either paired or singular. And it's important to know which is which, obviously. Now, the good thing about that is less names that you have to remember, but you do need to know which ones are paired and which ones are not. So let's look at the viscerocranium right here. Every bone is going to be paired except 2. The vomer, which is in your nasal cavity in there, and your mandible, which is right here. These are not paired, they're singular, right? Everything else in the viscerocranium is going to be paired. Now, let's look at the neurocranium. And in order to learn or memorize the bones of the neurocranium, I want you to use this mnemonic, which is called step off. S will be for your sphenoid bone, which is in there, that green sticker you see with the S on it. And that's just going to be one bone. And you're like, well, how is it one bone? Because you can see it in both orbits. Well, because it sort of spans across in the middle of the skull. I sort of think of it like the equator of the skull. It's inside and it spans across. So it's only one bone. Now, the next letter, which is T, is for temporal, and that, as you know, is going to be on both sides, right? Both sides of your temple. So those are going to be 2 bones. The next one, E, is for ethmoid, which is in here. It's sort of like where your tear duct is. It's going to be in that area. That's your ethmoid bone, and there's only one again, because this one is also a bone that's sort of in the middle of your skull. It sort of it starts in the middle and it spans out a little bit, so there's only one bone. And then we've got 2 parietal bones, which are on top right here, right on top of your head. And then occipital, there's only one, and that's going to be in the back. And then, of course, 1 frontal, which is right here. There we go. So there you have it. There's your mnemonic for all the neurocranium bones. All right, let's dig deeper. Let's talk sutures. Sutures are fibrous connective tissue joints that basically connect 2 bony plates together, and they are synarthrosis joints, meaning that they have some mobility that they offer. And the unique thing about sutures is they are pliable during birth, and then as we age they become more rigid because they ossify and they provide us more protection. So during birth we need that pliability, right, to get through the birth canal, and then later on we need more protection, and so they sort of evolve with the human needs, I guess. Okay, so what are the names of the sutures? Now, I have a mnemonic for you on the screen, and it's going to be the lazy cat sleeps safely. So the or the is not the first letter of the suture because there's only 4. So that's just for being grammatically correct. And lazy is the first suture we're going to identify, and that's your lambdoid suture, which is in the back. It sort of separates the parietal bones from the occipital bone. Okay, the next one is cat, which you've probably guessed is coronal suture. Now, this one separates the frontal bone with the back parietal bones, okay? And then we've got the next one, which is going to be your sagittal suture. Again, this, remember from your anatomical positions, it divides the body into left and right. So it's going to go right over the top here, and it's dividing the two parietal bones along midline. Then lastly, we've got the squamous suture, which basically connects the parietal and temporal bones. Okay, so those are your sutures. And let's move on to the next set of bones. This is the anterior view of Simon, our model skull. We're going to just take a peek at all the key features. So across here you have the coronal suture, and then of course the frontal bone. Glabella is this sort of area between your eyebrows, and if you know anybody Indian, you will see that Indian women tend to wear the sticker right here as a fashion accessory, and that's actually on the glabella. Okay, then we've got the orbital foramen here, which is called a supraorbital foramen, and then this is the anterior view of Simon, our model skull. We're going to just take a peek at all the key features. So across here you have the coronal suture, and then of course the frontal bone. Glabella is this sort of area between your eyebrows, and if you know anybody Indian, you will see that Indian women tend to wear the sticker right here as a fashion accessory, and that's actually on the glabella. Okay, then we've got the orbital foramen here, which is called a supraorbital foramen, and then the supraorbital margin, which has muscle attachments to it. Inside the orbit, you've got the sphenoid bone back here, frontal bone here, zygomatic, ethmoid bone, lacrimal, and maxilla. And then in back here, you may be able to see the palatine bone, but it's just a little smidgen there. So maxilla extends all the way here, and we've got some alveolar processes. And here we have the joining of the zygomatic and the maxilla. And this right here is called the infraorbital foramen. Okay, now nasal bone is going to be right there. And if you look inside the nasal cavity, you've got a perpendicular plate, and then and the mnemonic for the anterior aspect of the skull is going to be Fancy Nancy eats very modest meals. So we start at the top and we work our way down. So the very top is going to be frontal, fancy for frontal. Nancy is going to be your nasal bone. Eats is your ethmoid bone, which is actually seen in your orbit right there. It's off a little bit. And then you've got V, which is Vomer. It's going to be in your nasal cavity. And modest is from Maxilla, which is right there. And meals is for Mandible, which is right there. So there you go. Fancy Nancy eats very modest meals. Let's take a look at the right lateral view of the skull and highlight some of the landmarks and bones. Okay, so here we've got the frontal bone, coronal suture, parietal bone, This red one here is going to be your squamous suture, temporal bone, right? And then we've also got the zygomatic bone. And here we've got the squamous temporal area. And then this let's take a look at the right lateral view of the skull and highlight some of the landmarks and bones. Okay, so here we've got the frontal bone, coronal suture, parietal bone. This red one here is going to be your squamous suture, temporal bone, right? And then we've also got the zygomatic bone. And here we've got the squamous temporal area. And then this indentation here is your external acoustic meatus. The blue one right there, hopefully you can see that, is the lambdoid suture. Then you've got this sort of mastoid portion, styloid process because it looks like a stylo, like a pen, right? And then you've also got the actual mastoid process, which is this little, and you can actually feel that quite easily. Occipital bone's going to be back there. Mandible, you're aware of that. And then we've got this area here, it sort of juts out just a tad, your chin area. That's the mental protuberance of the mandible, okay? Now I want you to look at this sort of articulation here. This is two landmarks. First is going to be the mandibular fossa, and then it's going to be this tubercle, which is called the articular tubercle. Now looking in a little bit on this side, we've got the maxilla, and remember the alveolar process is going to be right there too. And then zygomatic, right? And then, yes, the nasal bone. Now you won't be able to see much inside the nasal bone, but you can see that this is the maxilla, and then here is the nasal bone. Now, in looking inside the orbit somewhat, you're going to be able to see the lacrimal bone. This is actually the lacrimal fossa. This is the entire bone. And then behind that, we've got the ethmoid bone, right? And the rest is a bit technical to see, but you will be able to see the frontal and, of course, the maxilla. Okay, going back up here, remember these are the sutures. So we've got the coronal suture.
Let's have a quick peek at the cranial fossa. This one's super easy because there's only 3, and basically fossa means ditch or trench, right? So it's going to be a depression, and it's an area which houses specific parts of your brain. So the first one is the anterior cranial fossa, which is going to be in yellow, and you can see it in a superior view but also in a lateral view on the bottom. Then we've got the middle cranial fossa, again pretty self-explanatory, that's going to be in pink, and you again can see it in a lateral purview. And then of course lastly, posterior cranial fossa. So fairly easy to remember and memorize. Just remember that fossa means trench or dip, so that might cue you in too.
Now let's take a peek at the orbit, looking at all the structures that are present in the orbit, right? So the first thing I want to orient you to is, of course, this. And I think by now you know that's going to be your optical canal. Then you've got the frontal bone right here, right? That goes up there. Then
up here, you're going to have the sphenoid bone that's going to start, and that's the lesser wing of the sphenoid bone. And then there's that fissure, right there. That's the superior orbital fissure. And then you've got this greater wing of the sphenoid bone. And then on the side here, that's your zygomatic bone. And then this down here is your inferior orbital fissure, right? And then down here, this is your part of your maxilla. Now, there is this little triangle. Do you see that? That's your palatine bone. You just see a little smidgen of it. And then on top of that is your ethmoid bone. Again, this is still frontal, ethmoid bone. And then, of course, we've got the lacrimal bone here. Right? And there you have it.
Here's another mnemonic for you to remember all the bones in the orbit area. It's some zebras might like eating food pellets. So some is going to be for your sphenoid bone. Zebras is going to be for your zygomatic. Might, I'm sure you guessed it, is maxilla. Like is lacrimal. Eat is ethmoid. Food is frontal, and palates is for palatine bone, which is really hard to see. It's basically just a smidgen. But there you have it. That is a mnemonic to remember the orbit bones. Moseying on to the structures of the fossae, right? We've talked about the fossae. Well, what structures are in there? That's what we're going to talk about. So again, to orient you, you're doing a transverse section of your skull, pulling off the skull cap and then peeking inside. So orient yourself here to the frontal bone, which is very easy to identify. Then we've got two structures, crista galli and the cribriform plate. Now you might be like, oh my gosh, that's like a foreign language to me, because essentially it is. Crista galli means, or translates in Latin, to the crest of the rooster. And that's exactly what it looks like. It's sort of this triangular ridge that projects up into the cribriform plate and then comes down to the roof of the nasal cavity. And then the function for this crista galli is that it attaches to something called the falx cerebri, which is the part of the dura mater, you know, that lining of the brain, that separates the left and right hemispheres. So it sort of attaches to that. Okay, moving on to the cribriform plate. That one's a little different. It looks different too. It's spongy bone and it's got these two canals. So these grooves are on either side of the crista galli, right? And they house the olfactory nerve bulbs. They lay there. And then it's got this sort of, sieve type perforated appearance, because the nerve fibers then project through it, right? So that's why it's got these little tiny holes that you would see in the cribriform plate. So again, on its either side of the crista galli. Now let's look at the sphenoid bone, and there's two structures here. We've got the lesser wing and the hypopophyseal fossa. Both of these together make something called the sella turcica, and that is like it's translated to Turkish saddle. So it's the saddle-like appearance, and this houses the pituitary gland, including the stalks of the pituitary gland. Next, we've got foramen lacerum, and I'm going to discuss all the foramen in the next slide, so I'm not going to talk about it anymore here. And then we've got the temporal lobe, which is fairly easy to identify, but there is a petrous region of the temporal lobe that you, or not lobe, bone that you need to think about, and that actually houses the inner ear. So very important that you know that aspect too. Then we've got the jugular foramen. Again, we'll discuss it in a bit. Parietal bone, occipital bone, foramen magnum, which you know, and the hypoglossal canal. Now this canal, the name should clue you, glossal means tongue, so it's going to house cranial nerve 12.
And then we've got the internal acoustic meatus. Now this one has a lot of drama going on there because obviously it connects to your inner ear, right? So this has, it's got, let's see, basically connects the inner ear to the posterior cranial fossa, and it has the facial vestibular nerves that go through it. It has the labyrinth artery, and it also has vestibular ganglion. So it's a lot going on there in this little canal, or not canal, meatus. Okay, then we've got some foramen, and these are a bit tricky to identify, and so I do have a bit of a mnemonic for you in the next slide. But we've got foramen spinosum, foramen ovale, and then foramen rotundum. Okay. Then we've got the superior orbital fissure. Now this is again a triangular shaped opening that you can't see very well here, but basically it connects the orbit, your eye socket, to the middle of the cranial fossa. All right, there you have it. A quick mnemonic for you here. It's fit, energetic, seniors, train often. Starting from the anterior to the posterior, you can see that each letter of the word corresponds to the bone. So we've got fit is frontal bone, energetic is going to be for the ethmoid bone, and then seniors is your sphenoid bone, temporal, train is temporal, and then often is occipital. So just a quick little mnemonic for you. Let's talk foramina. I did promise that we would sort of dive in a little bit better into foramina because foramen basically means holes in Latins, and there are tons of holes in the skeleton, right? And specifically in the skull. And so trying to sort of get them organized and sorted in your head can be a bit tricky. So here we have a mnemonic. Now, the mnemonic is actually for arteries, veins, and nerves that are in the sort of foramina and passageways in the skull. So not every structure that is in this mnemonic is actually a foramen in the sheer sense of it, but it really helps us identify the foramen, and it also helps us identify the location of specific cranial nerves that go through the skull. So let's take a peek. We've got the mnemonic: creepy old round oval spiders lie around jugs, help me. Okay, so creepy is going to be for cribriform plate, and you know that cranial nerve number 1, which is the olfactory, goes through there or lays there, and you know it has fibers that sort of project through. Okay, and then you've got the optical canal. Makes sense. The optic nerve, so cranial nerve number 2, is going to go through there. Okay, then we've got the foramen rotundum. That is for round. So creepy old round is going to be for rotundum. Now this is where we have cranial nerve number 5. Okay, then we've got oval for ovale, cranial nerve number 5. There's a branch that goes through there too, and that is that. Then we've got the foramen spinosum, which is going to be the word for spiders, right? And this one is a little different. It doesn't have a nerve, but what it has is the mid-meningeal artery that goes through there. Then we've got one that's the foramen lacerum, right? And that's for lie, spiders lie. So the lacerum actually has the internal carotid artery that goes through there. And the way you can remember is that you don't want to lacerate your carotid artery, of course. And then we've got the next word, which is around, and that is for acoustic meatus. Now, the acoustic meatus is going to be in the petrous part of the temporal bone, and the cranial nerves 7 and 8 will actually go through there. All right, keep going here. We've got jugs, which is for jugular foramen. Now this one has cranial nerves 9, 10, and 11 that go through it. And then the hypoglossal canal, so it's not a foramen, but it's a canal. And yeah, this one, naturally, I mean, you can figure it out, it's going to be the hypoglossal nerve that goes through there, which is nerve 12.
And then, of course, we've got the foramen magnum. That's going to be for me, right? So hypoglossal was help, and then me is for magnum. So that sort of tells you all the sort of structures that have arteries and nerves and veins that go through it. Oh, although there is another one, which is the superior orbital fissure right here that you see, that is not part of the mnemonic, but this actually also houses a lot of things. Now, it's not quite a foramen because it's more like a slit, I guess. I don't know. It's not quite classified as a foramen. And basically this is right under the lesser wing of the sphenoid bone, and it has several nerves that go through it. The 3, 4, 6, and 5 go through there. So those are the missing nerves. You're probably like, where are those? So that's where that is, but it's not quite part of the mnemonic, unfortunately, right? So there you have it. This is a superior view of the skull base. So to orient you, here is Simon the skull's face, and we are looking at things superiorly from the top. Okay, so starting off, we've got the frontal bone, the ethmoid bone, which has the crista galli and the cribriform plates on either side. Then we've got the sphenoid bone, as you can see, and that has the lesser wing, a greater wing, and it also has the hypopophyseal fossa. The lesser wing and the hypopophyseal fossa together make sella turcica, where the pituitary. This is a superior view of the skull base. So to orient you, here is Simon the skull's face, and we are looking at things superiorly from the top. Okay, so starting off, we've got the frontal bone, the ethmoid bone, which has the crista galli and the cribriform plates on either side. Then we've got the sphenoid bone, as you can see, and that has the lesser wing, a greater wing, and it also has the hypopophyseal fossa. The lesser wing and the hypopophyseal fossa together make sella turcica, where the pituitary gland rests. Okay, then we've got the temporal bones and the parietal on the side, which you can't see, and the occipital in the back. All right, so now let's look at some of these openings. The very first opening that you're going to see is the optical canal right here. And I think you should be able to see it, right? Like that. So you can see where it sort of comes out. Now, the best way to do this, again, is to use wiki sticks or pipe cleaners to try to get a more 3D perspective on the canals and what sort of goes where. All right, so that is your optical canal. The next thing you want to look at is this is the lesser wing of the sphenoid bone, and under here, it's a bit tricky to see, but under there you've got something called the superior orbital fissure. Now, it's not a foramina, it's not a hole, it's more like a crack, but it's got several structures that go through there. Then we've got this. This is the foramen rotundum. Now, the foramen rotundum was not drilled out in my skull model, so I just sort of drew it, but that's where that would be, and it would be a round sort of looking foramen, hence the name rotundum. Then we've got an oval looking one, which is foramen ovale, and then one that looks like a little dot, that's going to be your foramen spinosum. So, and on this side you can see here is rotundum, here is ovale, and then this is a spinosum. Okay, now next to it, or adjacent specifically to the ovale, is this, and this is your, let me look at it on this side, this purple structure here, that is going to be your lacerum, foramen lacerum, and this actually houses the carotid artery. So I think about it this way, like you don't want to lacerate your carotid, right? So that's how I remember foramen lacerum has that structure going through it. Okay, so moving on, let's look over here. This is actually your it's called the petrous region of the temporal bone, and there's actually a petrous ridge too. And then under there is
this sort of opening, and that's going to be your internal acoustic meatus, right? That's what that is. Okay, then you've got this fairly large foramina, and this is going to be your second largest, because obviously foramen. Now let's take a look at the base of the skull foramina contents, but we're going to draw them because this is a great kinesthetic way of really mastering the foramina. So here we have the base of the skull, and you can draw it out, or you can just take a printout of the base of the skull, put it in a sheet protector, and then follow along. So the first thing we want to do is sort of orient ourselves. Frontal bone, temporal, sphenoid, parietal, occipital. Here's the ethmoid bone, and that's your cristogali and your cribriform plates on either side. And then, of course, we've got the big hole, which is your foramen magnum. So starting at the top, the very first is going to be your optical canal, and that's fairly easy as far as a landmark because you'll see those structures fairly easily in that area. Then we want to go to the superior orbital fissure, which is right under the lesser wing of the sphenoid bone, right? That's going to be a little different in structure because remember, it's a fissure. It's not quite a hole. It's more like a crack, right? And then after that, what comes next? We've got the rotundum, which is going to be right here, and it will be round. After the rotundum, we know that we've got ovale, which will have this oval appearance. So foramen ovale. And then after that, we want to find the other one, which is the lacerum. And that's more like a laceration. It's like a teardrop almost. And that's going to be right next to it, foramen lacerum. Okay, but we forgot one, didn't we? The spinosum. So that's just going to be a little dot right there. Okay, to review, optical canal, superior orbital fissure, rotundum, ovale, spinosum, and lacerum, right? Okay, then we've got the next one, which is going to be your external acoustic meatus, and that's actually going to be right here. Oh, let me see if I could draw it. It's like a little kidney bean. That's going to be your internal acoustic meatus, and then right sort of under that, at the border here of the occipital and temporal, is the big one, right? This is your jugular foramen. Now, don't pay attention to the sizing, so because it's a little technical to get the sizing accurate from this perspective, but essentially that's what that is, right? So we've got your internal acoustic meatus, your jugular foramen, and now, of course, you know this one, the foramen magnum, but you remember there's one that's either side of the foramen magnum. Do you remember what that is? So we're going to draw that right there and right there. That's going to be your hypoglossal canal, right? And there you have it. Those are somewhat of the foramina that you might see, and again, it's super helpful to draw it out, so I definitely encourage that. Now we're looking at the temporal bone, which forms the lateral side of the skull, right? And the reason it's called the temporal bone is because temporal means time. And it's named because that's the area, right? Our temples is where, as we age, that's where we start graying. Our hair, starts graying in that spot. So that's essentially where the name comes from. So some aspects of the temporal bone you already know. You know there's a squamous portion and a petrous portion. But I do want to highlight the external acoustic meatus that is basically going to be linking the ear to the skull. And then we've got another portion here, which is the articular tubercle. And this tubercle, we talked about it earlier, but this along with the mandibular fossa, they connect to form the temporomandibular joint, which enables us to articulate with that joint, right? The reason I can talk to you is because I'm able to use that joint for movement. And then, of course, we've got the styloid process that I wanted to highlight, and that essentially is going to be an insertion point for ligaments and muscles of the neck and the hyoid bone, which we will cover later. Right, now it is time for the sphenoid bone. And this bone is my favorite bone of the skull. It is because everything sort of happens here. It's the keystone bone. It's like the equator. Everything sort of connects there. Almost every bone connects there. And basically has this sort of butterfly appearance, and it has these aspects that cover the central part of the skull, but also the lateral. It sort of permeates in these other areas. So let's take a peek at it. Again, we're going to look at the superior view first. And what you're going to find is it has a body, just like a butterfly might, right? It has a little body in the middle. And then it's going to have something that's more like wings. But before we get to the wings, I want to talk about the hypophyseal fossa of the sella turcica. That is the saddle. Remember that? That's where the pituitary gland is going to be. Okay, then we've got the greater wing. So it's got this broad sort of wing-like appearance. And then, of course, we've got something that's the optical canal, and that's going to be situated right above that sella turcica area. Then we've got the lesser wing. So again, it's sort of in the wingspan, but this is going to be a skinnier version, essentially. And then moving on, we've got the superior orbital fissure. You remember that one. And then we've got the 3 foramen. Now, remember the acronym for these 3? It's going to be rotundum, ovale, and spinosum, ROS, right? So that now you know the order, rotundum, ovale, and spinosum. And then if we look at the posterior view, you can see again, it looks less like a butterfly, but it still does. You've got the greater wings on top, and then of course again you've got the body of the sphenoid bone, and then we've got the lesser wings, and we also have the orbital fissures, which are basically the superior ones, and they look like eyes to me, so it's fairly easy to figure that out. And then we've got these pterygoid plates that it still would classify like a butterfly, right? There's some butterflies that have that sort of configuration. So there you have it. That's the sphenoid bone. And let's move on. Now let's take a look at things from an inferior point of view. So here is the face of Simon our skull, and we are looking from an inferior perspective. So the first thing you want to do is orient yourself to the maxilla, which is right here. And then we've got this portion, which is your palatine bone. Then here we've got your medial and lateral pterygoid bones or plates. Then we've got the vomer right there. And of course, you can sort of visualize the sphenoid bone, which is going to look like that butterfly. Now let's take a look at things from an inferior point of view. So here is the face of Simon our skull, and we are looking from an inferior perspective. So the first thing you want to do is orient yourself to the maxilla, which is right here, and then we've got this portion, which is your palatine bone. Then here we've got your medial and lateral pterygoid bones or plates. Then we've got the vomer right there. And of course, you can sort of visualize the sphenoid bone, which is going to look like that butterfly, and then temporal on the sides and occipital in the back. Okay, now, oh, zygomatic bone on the sides too. Now, the first foramina you can see in this perspective is going to be this blue one, which if you look on this side is an oval structure. So what's that going to be? The foramen ovale, right? Then next to that, we've got the foramen spinosum, naturally, right? That's going to be the important one. And then this one is, you remember, that's going to be the foramen lacerum. And you can see this is that one, right? Okay. So we've got ovale, spinosum, and lacerum that you can see from this side. But then, of course, we've got the big one, right? Which is this. It's kind of hard to see, but there you go. This is going to be your jugular foramen, right? Super important. So that's going to be the biggest one, biggest foramen, other than obviously foramen magnum. Okay, so we've got those sorted. What else can we see? We can see the occipital condyles. There are two, and they're sort of these smooth surfaces, and that's going to articulate with the atlas C1 vertebra to enable us to nod our head yes, right? This is going to be the articulation point for that, okay? All right, and so then by the occipital condyle, you'll see under here, we've got this green one, this green structure, and that is your hypoglossal canal, right? And we have to take a peek at the posterior, of course. That's the only part we've sort of ignored, right? So here we've got the sagittal suture. Up here, parietal bones, occipital bone, obviously. The blue is the lambdoid suture. And then this little bony prominence is your external occipital protuberance. And you can feel that fairly easily. And then we've got the superior nuchal line, temporal bones on either side, and then we have to take a peek at the posterior, of course. That's the only part we've sort of ignored, right? So here we've got the sagittal suture. Up here, parietal bones, occipital bone, obviously. The blue is the lambdoid suture, and then this little bony prominence is your external occipital protuberance, and you can feel that fairly easily. And then we've got the superior nuchal Here we have a sagittal purview of the skull. So basically you've taken a cross section sort of this way, right? Down the middle, right? Left and right sides. So let's take a peek at the structures here. So the first thing I want to orient you to is your nasal bone. That's the green on this view right here on this visual. And on top of that, you've got the frontal sinus. So that's going to be right on top. And then the next structure is actually behind your frontal sinus, and that's your crista galli. And underneath the crista galli, or actually parallel to them, is going to be your cribriform plate, and that's all part of the ethmoid bone. The next portion that you see in black, that is actually a perpendicular bone that's going to be in your nasal area. So it's the perpendicular plate. Next, we see this area, which is pretty easy to recognize being the maxilla, because that's where your teeth are, right? That's going to be right in front. And then we've got another spot that's in your nasal area. So you've got that perpendicular bone, but then you've also got something called the inferior nasal concha. And behind that, what are you going to have, right? You've got the perpendicular plate on the top, and then on the bottom it's the vomer. Like if you look into your nostrils, that's what you're going to see. You're going to see the perpendicular plate and then vomer bone. After that, you've probably guessed it, the bone that's in the center of your skull almost is going to be the sphenoid bone. And then the next structure that we need to look at is actually within that, which is the sphenoid sinus. So remember, we've got a sinus in the front and then we've got one in the center. Sort of makes sense, right? You want to have one in each area. And then these two areas that are shaded here, one's that light blue color and then the other one is the yellowish color. Those are going to be your medial and lateral pterygoid glands. And they're right behind that maxilla vomer area. The next structure you want to look at is the internal acoustic meatus now. So we have an internal and we have an external. So this is the view of the internal. And then, of course, we have this, and you've probably figured this one out by now. This is the hypoglossal canal. This is where the hypoglossal nerve is going to passage through. Then we've got the mandibular foramen. Okay, so that's a little hole that you're going to see on the sides of your mandible. And close to that area, you're going to see, it's a bit tricky to see here, but you've got something called the lingula. It's a landmark. It's like a little groove that you would see there. And then the next thing that we're looking at is actually the hyoid bone, and we're going to actually cover that in a little bit again, but that's another important structure that you want to identify. And then we've got another little ridge type looking landmark on the mandible, and that's your mylohyoid line. Okay, and that's essentially everything that we have from a sagittal perspective. Of course, you can, I think by now you know all the other prominent areas, right? Like the temporal, parietal and all that. But I wanted to give you a little highlight of some of the key smaller structures that may not be as apparent. The ethmoid bone is a little different than the sphenoid bone. It's still in the somewhat center of the brain, but it's a little bit more forward. It's going to be in the midline area. It's a single bone, and what it does, it sort of projects into the nasal cavity. What it does is it forms like the roof and lateral walls of the upper nasal cavity and the upper portion of the nasal septum. Now, if you look at the visual we have here, you can see that there's this, from on a superior perspective, there is something called the crista galli. And if you remember what that means, it actually translates to rooster's crest. That's what that means. And what it does, it serves as an attachment, almost like anchoring the brain, because it serves as an attachment for the dura mater, a specific portion of the dura mater that's called falx cerebri. And it's sort of this fold of the dura mater that separates the left and right hemispheres, and that's what attaches to the crista galli. Now, what is on either side of the crista galli? There are these parallel sort of canals or plates, and that's going to be the cribriform plates, right? And the cribriform plates are a little bit different, right? Cribrum means sieve. Gosh, it's a mouthful. A lot of these words in anatomy and physiology are. Anyway, it's sort of this small flattened area with these tiny small openings, many of them numerous, and they're actually called olfactory foramina. That's what you're going to find on the cribriform plate. Now, several branches from the olfactory areas of the nasal cavity pass through these openings and into the brain, okay? And then, of course, we've got the concha. And you remember seeing the concha when we were doing the anatomy of the skull, right? You could see some of them, but you can't see all of them from this anterior perspective. And of course, again, highlighted here is the nasal cavity, but then there's the middle concha, and there's also an inferior concha. And then that plate in the middle is your perpendicular plate, and that essentially divides the nasal cavity into left and right. And then, of course, we've already talked about the ethmoid air cells. They're part of your parasinus cavity. You know, it looks like bubbles. This is very unique to the ethmoid bone. And then, of course, we've got something that's called the medial wall of the orbit, because the ethmoid, not only does it proliferate in the nasal area, but it sort of spreads into the orbit closest to the nasal area. Okay, let's look at this other view of the ethmoid bone, and you can see the sphenoidal sinus that's highlighted there. And then you've also got basically the superior nasal concha, middle and inferior highlighted. I mean, pretty self-explanatory, the top, middle and bottom, right? And there we have it. That's essentially your ethmoid bone. The nasal septum and nasal conchae. Now, I'm not going to spend a lot of time on this, but just to orient you, we've got a sagittal view here. The frontal bone, the frontal sinus are prominent features here, obviously right above the nasal bone. And then we've got septal cartilage that you can sort of feel when you feel your nose, right? It gives it that fluidity and yet separates structures. Now, inside this nasal septum, we've got concha or conchae. So what conchae do, they have an important role. What they do is they sort of swirl the air that we breathe in, warm it, moisturize it before it sort of goes into our lungs, which are a very delicate organ, right? And what this does is it allows mucus to sort of cleanse the air, trap any sort of dust, pollen, viruses, bacteria, etc. That's what the conchae serve to do. Now, the largest concha is the inferior nasal concha, and that is an independent bone of the skull. The other two, the middle and the superior conchae, are actually smaller, and they're both part of the ethmoid bone. And you can't always see the superior concha when you're looking anteriorly at your nose, but you can see the inferior and the middle. So that's just something important to remember. Then, of course, you've got the palatine process of the maxilla in this picture, which is also an important feature. Horizontal plate of the palatine bone is what you see next. And then I'm sure you've guessed the vomer bone, which is right directly under the nasal perpendicular plate, right? And then, of course, we've also got the sphenoid bone, which you're probably very familiar with by now because we've talked about it so much, the perpendicular bone, and then, of course, the sinus. And lastly, everybody knows this fancy word by now is the crista galli. So there you have it.
The maxillary bone, which is often referred to as the maxilla often, is actually two bones that are put together and they form the hard palate of your mouth. Also part of your eye socket and then part of your nose. So that's important to remember. Now, the part here that articulates with the frontal bone. Right, and then the next portion that you see in the green is basically where the zygomatic process sort of joins. Then we've got the infraorbital foramen. Now this is a foramen where basically a lot of the sensory nerve supplies go through here. Sensory nerves go through here that supply the nose, upper lip, and sort of cheek area. So that's what that is for. Okay, and then we've got the alveolar process. That's where your teeth basically are placed into, articulate with the socket, the alveolus socket. That's essentially what that is. So very simple bone, essentially, but it's got lots of features that you need to be aware of. Right, the mandible is one of those sneaky bones that it's quite remarkable because we think of it as one bone, but it's actually not. It starts off as this paired right and left bone, and then it fuses within the first year of life. And it makes sense, right? In order to get through the passage, the birth canal, right? We have to be able to have that pliability, and that's what that offers. So it does fuse and forms that U-shaped bone. Now, there's several features of the mandible that are important. Now, here we have a right lateral purview. There are two that you're probably very familiar with already, the condylar process and the coronoid process. The coronoid process is basically going to serve as an attachment for muscles for biting. All the muscles involved in biting, that's what they're going to be. The condylar process is going to be the spot where we have the temporomandibular joint, right? That mandibular fossa articulates with the articular tubercle and forms the temporomandibular joint and enables us to open and close the jaw or the mandible. Now, having said that, the mandible is the only movable part of the skull. Right? Now, what prevents it from opening too much, right? Because that could be a real problem and cause lots of injury. That's where we have the lingula. Lingula means small tongue. So it's this flap of bone that sticks out a little bit, and a ligament attaches to that. And that's what keeps our jaw anchored and stable. Then we've got the mandibular foramen, and that's a very interesting feature because this foramen has it's an opening, and then it has a tunnel that runs alongside the mandible under the jawline where the teeth are. Why is it important? Because think about when you go to the dentist and you need to get dental work done. Well, this is where they're going to inject the anesthesia, and that's going to travel through the foramina into this canal so that all the sensory nerves are numbed essentially, and they can do whatever dental work. So it's a very important foramen. I keep saying foramina. Foramina is plural, foramen. Okay, then we've got the mylohyoid line, and that's going to be a little bony ridge where some of the muscles of the floor of the oral cavity attach. Alveolar process, you already know that. And then we also have the chin, which is the mental protuberance. And then, of course, we've got the body of the mandible, which is basically, your jawline, right? And the angle is exactly what it says. It's that sort of edge point of your jawline. And the ramus is going to be this angle up here. And then, of course, you can actually feel your mandibular condyle if you get the opportunity to just put your hand here and especially move your jaw, like talk, and you can feel it. And then that notch is the little dip. So essentially, this is the mandible. Paranasal sinuses. Now, we are all familiar with this. How many of you have had a sinus infection or, are congested? Well, those are your sinuses. And these are hollow air-filled spaces located inside certain bones of the skull. And they communicate essentially to the nasal cavity. They're all sort of connected, right? Paranasal means next to nasal cavity. And of course, they're lined with nasal mucosa that goes mad and crazy when we're sick, and they overproduce mucus, and that's where we get that sort of congestion. They also reduce bone mass, right? Because it lightens the skull, having this air-filled space. Now, let's look at where they're all located. The frontal, which makes sense, is going to be right at your frontal bone area, and of course we've got an anterior and a lateral view here. Then we've got the sphenoid sinus, and that's going to be obviously in this sort of bridge area, and you know this is going to be the most posterior sinus. Then we've got the ethmoid air cells. You remember those, right? We talked about those. This is this green feature that you see here, and basically what happens with ethmoid cells is they are the ones, remember we looked at the ethmoid bone that looks like it's got bubbles? So these are the air cells of the ethmoid, and those are actually going to be part of the sinuses. And then the maxillary sinus is the largest, as you can see, and it's located closest to the nasal cavity. And this is actually where we have the main sinus infection, is the maxillary area. I don't know if it's just because of the proximity to the nasal aspect, but it is definitely an area that gets more infected than the others. And that's sinuses for you. The last little bone we're going to talk about is the hyoid bone. Now, it's not technically part of the skull, but we just sort of include it in this presentation because there's not a lot to it. It's actually a U-shaped bone, right? So it's sort of this U shape, and then it attaches essentially like so, right? And basically the tips of the U are pointing towards the mandible. That's essentially what you need to remember. And this bone attaches to a series of small muscles, either from above or below. And this helps the hyoid bone go up, down, forward, and backwards, because these movements are what help us coordinate things like using our tongue, our larynx, our pharynx, i.e. swallowing and speaking. That's essentially, if I didn't have my hyoid bone, I think it would be really hard for me to do this presentation, essentially, right? So some of the features, there's not many. As you can see, it's a very small bone, but we've got the greater horn, and we've got an anterior and lateral view of that. And then we've got the lesser horn, so fairly easy to remember. And then, of course, the body. That's essentially the hyoid bone. Okay, now we're finally ready for our mind map, because there was a lot to cover, right? The skull obviously is one of the most complex aspects of our body, and the anatomical features, there's so many. That's why this mind map is loaded. It's loaded with mnemonics and lots of key features that you need to know. So use this as a study guide, print it out and jot down things that you need, because you have all the mnemonics in one place to really memorize some of the aspects. And don't forget, if you can get a model of a skull, get it from the library and get some pipe cleaners and use those to really figure out different foraminas, because that's really going to help you from a hands-on kinesthetic learning perspective. Again, comment below if you found this helpful, or if there's anything else you'd like me to add to this topic, and I will see you next week. Bye-bye now.